Good morning. Today I would like to discuss some new recommendations for elementary education and some new youth sports guidelines. As you know, we closely track the rate of COVID-19 cases among children and teens. We've found a steady increase in the 15 to 19-year-old age group. In fact, 90% of the COVID infections around schools over the past 2 weeks have been in middle and high school students. In fact, the rate of new cases among high school students is nearly 20 times or nearly 5 times the rate of younger students. And additionally, the positivity rate of adolescents in the 15 to 19-year-old age group is 20%. And the positivity rate in children 5 to 9 is only 6%. So based on the current data, the Department of Public Health is modifying their recommendations so schools may consider a process of transition into in-person education for elementary school students, if they decide that that's the right decision for them. St. Louis County is not mandating that they do this, nor are we setting the criteria for them to do so, but we are pointing out that the data currently supports an option for in-person learning for these younger students. We all are aware of the fact that many schools have put a lot of time and energy into virtual education for their students. It's not an easy process. And we urge parents and families to be patient with schools as they determine individually their next steps. School district leaders have significant factors to consider and plan for to determine if and when they'll return to in-person education for elementary students. We have full faith in our superintendents, our school leaders, and our teachers as they make plans to determine what's best for their students and for their families and for their staff to get students back into school buildings. We understand the disruption and the stress that it creates to go back and forth between individual and virtual education. And St. Louis County will be available to work with our school partners to make this as smooth as possible. As a result of our current data, the Department of Public Health is not currently recommending a transition to in-person learning for middle school and high school students. We'll work with our partners to protect and support these students and plan for their eventual transition back to in-person learning as soon as the data supports it. It is our shared goal to get there safely. Additionally, our data currently supports increased participation for some youth sports activities. We are currently today amending our youth sports guidelines for St. Louis County and adding a third classification of sports, moderate frequency contact sports. And our amendments are now aligned with recommendations from the St. Louis Sports Medicine COVID-19 Task Force and most of the recommendations from the state of Illinois. However, at this time, we will not allow the resumption of high-frequency contact athletic activities such as games, tournaments, and other competitions, or moderate frequency contact sports at the high school level. In line with our current recommendations regarding younger children, we think that there are some additional opportunities for younger children to engage in a wide variety of sports, including games and competitions within the region, again, for low and moderate contact sports. And all ages will be able to participate in low contact sports activities. All of the activities that our youth over 14 are participating in, not just sports, have the ability to increase COVID transmission among students and then subsequently back to their families. We know that all of these recommendations affect school sports fall seasons. Neither the St. Louis County guidelines nor the COVID Sports Medicine Task Force currently recommend competition games for high school students. The new guidelines from St. Louis County will make the distinction to allow sports competition for activities under age 14. We also know that the Missouri High School Athletics Association has given schools until September 17th to determine if they will take the option to move their fall school sports seasons to the spring. We are not mandating the St. Louis County schools move their season, but we also recommend how difficult it will be to put together games and competitions later this fall if the COVID transmission improves to the point where we could consider recommending competition and tournaments at the high school level of high contact sports. If schools choose to not move their season, they will still be required to follow the St. Louis County Youth Sports Guidelines and cannot engage in competitions at the high school level for limited sports until they are changed based on the number of cases of COVID infection among our high school students. This recommendation does provide schools with the opportunity to plan for ways to engage their students in a full season of play of activities at a later date. So even if the rate of transmission decreases enough to potentially allow for other youth sports to resume this fall, schools may struggle to plan a full season of play. And this decision, of course, is not a unique one. We've seen many colleges move their fall sports to a spring season. Many conferences have done the same. For details on our recommendations for youth sports, you can look on our webpage, stlcorona.com, where they are now published. I'll be glad to answer any questions.
Dr. Pate, what do you say to families who obviously have kids participating, many of whom have kids participating in these fall sports that can't go forward now? What's your message to them about why this decision was made for sports like football and soccer and volleyball? What's, in your mind, the key element for people to understand about why you did this?
Well, I think first we have to understand that that this pandemic has been tragic to many people in our community, including all the activities surrounding sports. That the responsibility of our Department of Public Health is to keep kids safe. And we see a rate of transmission in all activities that teenagers participate in, especially 15, 19-year-olds, including sports. And these recommendations are coming forward based on what's best to protect the health and welfare of teenagers who are currently having a rate of COVID transmission that is not acceptable, that puts them at risk, and it puts their families at risk. These activities that transmit infections are yet not unique to school sports, but school sports remain an area of high concern.